Hello and welcome to my presentation for my final project regarding goal setting for injury recovery. So, as an athletic trainer, I work with student athletes, and one of the most common things that I deal with are athletic injuries. And as a student athlete or any athlete, whether it's recreational, professional, or collegiate, high school, participating in athletics does have a tendency to place you at risk for potential injury. This can be as simple as an ankle sprain to full fracture, ACL tear. There's so many various injuries that potentially could happen. As an athletic trainer, it's my job to evaluate and care for any and all athletic-related injuries that occur to my student athlete population. And sometimes injuries recover super quick, and others, they linger a little bit longer and take a little bit more time. So my main question is, how, as an athletic trainer, can I keep my student athlete motivated during long time injury rehabilitation? How do I keep them coming in daily for treatment through the long, hard days of squats, leg raises, boring range of motion activities? How do I keep them motivated to keep wanting to come and continue on their journey back to play? Well, first of all, I need to understand the psychology that can occur to a student athlete or athlete after injury. And injuries do have a tendency to have a negative psychological effect. Studies have shown that when injured, a student athlete has increased levels of stress and anxiety, increased feelings of anger, as well as they don't necessarily want to adhere to a rehabilitation program or come in for treatment to help their injury on the path to recovery. They also have issues with motivation and even potential depression. Another psychological factor is what's been called athlete identity. This was defined by Brewer, Van Raalte, and Linder in 1993 as how much a student actually identifies with their role as an athlete. And usually students that strongly identify with being a student athlete or being an athlete have a tendency to not have as great of a balance between student, everyday person, and athlete. And so an individual who has the athletic part taken away from them due to injury may not be able to handle that psychologically as well as someone who is not that strongly identified with their athlete role. And so injury has that potential to affect that identity and could lead to challenges in their recovery. All of this can be connected to Covington's self-worth theory. And the self-worth theory refers to an individual's sense of competence. And we've all seen this in our lecture notes if you read the motivation lecture a few weeks ago. And basically, self-worth is how you feel if you are a successful person and kind of how you compare yourself to other individuals as being competent either in the classroom or on the athletic field or kind of in general. And it's basically if you view yourself as a failure or not. And so individuals that have strong self-worth view themselves as very competent and capable and adaptable in the things that they attempt. And they are able to handle failures a little bit better than individuals that have lower levels of self-worth. One concern as an athletic trainer is if you have a student athlete that has a season-ending injury or a very serious injury, is the effect on their self-worth, their feeling of being a failure. They're feeling that they've let their teammates down, themselves down, their coaches down, that all of the hard work and everything that they've done for the season is now gone because of this injury. And that in turn could lead them to potentially self-handicapping types of activities that could include not showing up for rehab appointments, not following through with protocols and treatments by their doctor, physical therapist, or athletic trainer. So it's really important to understand how the psychological situation of being injured can affect a student athlete's self-worth and potentially lead them towards not being as motivated to do their rehab and work through the healing process. So we understand that injuries happen. We know that it has a negative psychological effect potentially on student athletes, and we know that that could affect their feelings of self-worth and potentially lead them to feel like failures and not necessarily adhere to a rehab program. So how are we going to combat that? Well, a meta-analysis in 2017 actually revealed that rehab adherence had a strong positive effect on returning the athlete to their sport. That's kind of a duh. If you have an ankle sprain and the ankle is now weak, going to rehab is going to make it stronger and then get you back on the field. So that's a really kind of simple idea to remember, but again, it's also very important to understand that even though rehab is one thing that may get the athlete back sooner, they may still not always follow through because they're dealing with other feelings and emotional issues. So again, if the athlete can return to sport, it could help them regain their athlete identity and combat those negative psychological effects of injury. So keeping that athlete motivated to adhere to that rehab program is very important, and it will potentially combat that negative psychological feeling that they have, as well as help maintain their self-worth, help them maintain that positive view of themselves, that they are not a failure and that they can still be successful. So goal setting is one really strong component of a return to play rehab program. And this is something that can really help a student athlete stay motivated and focused on their treatment, on their return to play, really keep them invested and moving forward so that they are not kind of stuck on an island by themselves. There are a few types of goals out there, and making sure to kind of identify goals that will have long-term positive effects on a student athlete is really key. From an article review by Covington in 2000, he identified in the literature achievement goals and pro-social goals. Achievement goals can kind of be divided into two types. One would be a learning goal and the other is performance goal. A learning goal, it helps focus and improve one's competency on a subject. It improves their understanding and eventually their appreciation for the knowledge regarding that subject. So as an athletic trainer, identifying goals with the student athlete and teaching them why the rehab is so important and helping educate them on why the exercises or the rehab protocol you're utilizing will help them get better and reach those return to play and back on the field goals is really important. So really working with the student athlete to get them invested in their rehab and developing their own goals and really learning about the process versus just having them come in, give them some exercises to do and not really explaining why they're doing it. So I think that utilizing learning goals, we actually teach the athlete the importance of the exercise is pivotal. Now, performance goals are more of what Covington referred to as the ego goals, where they really focus on the student outperforming another student and being better than the other person, competitive, competing. They have more of a superficial kind of effect, whereas the learning goals are a little bit more deeper. They gain that deeper understanding. So it's really important to combine both of these to enhance that rehab process, making sure that the student athlete is learning and understanding why they are doing the exercises they're doing, but also focusing on some performance goals so that they have something to look forward to, as well as usually student athletes are a competitive person. So you can kind of play off of that deep understanding of what competition is. So you can kind of use both of those goals to create a rehab program that helps the student athlete move forward in their return to play. It's also important to get that athlete involved versus just telling them what to do. The more involvement they have, the more understanding they have, the more appreciation they will have. They will understand why they're doing the exercises they're doing, and they will hopefully be a little bit more invested. You can also utilize pro-social goals, which from Schneider, Ackerman, and Kampfer was basically defined as when an individual feels like they're accepted by their group or by their peers, kind of like a fitting in or being respected by their peers. So for me, it's holding them accountable, not only by you as the athletic trainer, but also by their team, explaining to them how, hey, if you come in for your rehab, you're actually helping your team. You're helping them get better because that's going to return you to the field where they need you. Supporting them going to watch film with the team, supporting them going to practice and watching practice and being vested and cheering on their teammates. Those are all pro-social goals that you can help work with the athlete to identify to help make them feel like they are accepted and respected by their teammates. It's a kind of a form of accountability, and it will help them feel a little bit more accepted by the group and not so much an island by themselves. And so identifying those pro-social goals will really help them feel like, hey, I am still an important part of this team and I need to do what I can to help them and my team get better. So for setting goals and rehabilitation, we do need to make sure that we're helping the athlete develop personal and meaningful goals. According to Covington, this will help get that deeper meaning and that understanding and that appreciation towards that understanding of why they're doing what they're doing, and should potentially motivate them to show up for their rehab and do the best that they can. Focusing on learning goals versus performance goals, focusing more on educating the athlete on why we're doing the exercises we're doing, but also having some of that competitiveness that is very true to athletics, that they kind of still have a little bit of ego-driven goals, and finding that nice balance between the both of them would be really good to initiate into a rehab protocol. There have also been studies that have found that goal setting increases self-efficacy and confidence in patients that are dealing with sport-related injury, and that can be connected back to that self-worth theory of, hey, if we can have goals, help that athlete reach those goals, it will increase their self-worth and their confidence and help them move forward into returning to play and back to the sport and their passion. So in conclusion, from this project, we basically know that injuries are going to happen and they can affect an athlete's recovery, and that it's important to understand the psychological aspects of rehabilitation. Goal setting can have a positive effect on an athlete's recovery. It can help focus them and keep them motivated to continue the rehab process. It is important, though, to make sure you balance those learning goals versus the performance goals to help gain a deeper and more meaningful connection with the rehab versus more of a superficial kind of ego-driven, oh, I can squat 5,000 pounds, but really getting them to understand the process and why you're doing what you're doing. And then keep that athlete accountable. Hold them accountable to their teammates and the athletic trainer via those pro-social goals so that they're invested and involved and don't feel like they're out there by themselves. Keep them involved and accountable to the team, and hopefully that will help bring them in and push them to be more motivated to show up for their treatments and to do their rehab as best as they can. Thank you.